A patient receiving furosemide reports muscle cramps and weakness. Which laboratory value should the LPN monitor most closely? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer B. Furosemide is a loop diuretic that causes potassium loss. Hypokalemia leads to muscle weakness, cramps, and cardiac arrhythmias, requiring close electrolyte monitoring. An LPN is reinforcing discharge teaching for a patient prescribed warfarin. Which statement indicates the need for further instruction? A. I will eat the same amount of green vegetables daily. B. I can use an electric razor instead of a blade. C. I'll report any bleeding gums to my provider. D. I will take aspirin for headaches while on warfarin. Answer D. Aspirin increases bleeding risk when combined with warfarin. Patients should use acetaminophen and avoid NSAIDs unless prescribed. When administering an intramuscular injection in the ventrogluteal site, the LPN should place the palm on which landmark? A. The iliac crest. B. The greater trochanter. C. The ischial tuberosity. D. The anterior superior iliac spine. Answer B. The ventrogluteal site is located using the greater trochanter as the starting point for proper injection placement, minimizing nerve and vessel injury. A patient on continuous enteral feeding via NG tube suddenly coughs and gags. What should the LPN do first? A. Stop the feeding immediately. B. Flush the tube with warm water. C. Check the tube for kinks. D. Increase the flow rate temporarily. Answer A. Coughing and gagging suggest aspiration or tube displacement. The LPN must stop the feeding immediately to prevent aspiration pneumonia. Which finding in a post-operative patient requires immediate nursing intervention? A. Pain at the incision site rated 7 out of 10. B. A pulse rate increase from 88 to 120 bpm. C. Small amount of serosanguinous drainage on dressing. D. Temperature of 99.8 degrees Fahrenheit. Answer B. A sudden rise in pulse may indicate internal bleeding or shock. The LPN should notify the RN or provider immediately for assessment. When providing care for a patient in restraints, the LPN should perform which action first? A. Remove restraints every 4 hours. B. Offer fluids every 2 hours. C. Check circulation and skin integrity frequently. D. Apply restraints tightly to prevent slipping. Answer C. Circulatory checks are critical to prevent injury. Skin breakdown, cyanosis, or numbness must be assessed at least every 15 minutes. An LPN notes a patient's urine output is 200 milliliters in 8 hours. What is the priority action? A. Document and continue monitoring. B. Encourage the patient to drink more fluids. C. Report the output to the RN or provider. D. Check for urinary infection. Answer C. Urine output less than 30 milliliters per hour indicates possible renal impairment or dehydration, requiring prompt reporting for evaluation. Which of the following actions demonstrates proper sterile technique during a dressing change? A. Opening sterile supplies before washing hands. B. Placing sterile items 2 inches from the field border. C. Touching the outer wrapper to adjust sterile gauze. D. Turning one's back to the sterile field briefly. Answer B. Maintaining a 1-inch margin ensures sterility within the field. Touching or turning away compromises the sterile area. A patient with COPD is receiving oxygen at 4 liters per minute via nasal cannula. The LPN should anticipate which complication? A. Hypoxia. B. Hypercapnia. C. Metabolic acidosis. D. Respiratory alkalosis. Answer B. COPD patients rely on hypoxic drive. Excessive oxygen may suppress respirations, leading to CO2 retention, hypercapnia. Which nursing action prevents pressure injuries in an immobile patient? A. Positioning the patient every 4 hours. B. Keeping the head of the bed at 60 degrees. C. Using a moisture barrier and repositioning every 2 hours. D. Massaging reddened bony areas to improve circulation. Answer C. Frequent repositioning and moisture protection reduce pressure and friction, key in preventing decubitus ulcers. Before administering digoxin, the LPN notes an apical pulse of 52 bpm. What should the nurse do next? A. Administer the medication with food. B. Notify the provider before giving the dose. C. Recheck the pulse in 10 minutes. D. Continue as prescribed if no dizziness is reported. Answer B. Digoxin slows heart rate. If the apical pulse is below 60 bpm, the dose should be withheld and the provider notified. The LPN reinforces teaching for a diabetic patient using insulin. Which statement indicates correct understanding? A. I can inject insulin into my arm every time for convenience. B. I will rotate sites within the same body area weekly. C. I can mix long-acting insulin with regular insulin. D. I should inject insulin immediately after exercise. Answer B. Site rotation prevents lipodystrophy. Rotation should occur within one region to maintain consistent absorption. Which assessment finding requires immediate intervention for a patient with a chest tube? A. Gentle bubbling in the water seal chamber. B. 25 milliliters of drainage in 2 hours. C. Drainage becomes bright red and increases rapidly. D. Occasional fluctuation of water level. Answer C. Sudden increase in bright red drainage suggests active bleeding. The LPN should notify the RN or provider immediately. A patient with a PEG tube refuses feeding. What is the LPN's best action? A. Force the feeding to maintain nutrition. B. Record the refusal and notify the nurse in charge. C. Disconnect the PEG tube permanently. D. Wait and try again after several hours without documentation. Answer B. Patients have the right to refuse treatment. The LPN must document and report to the RN or provider for follow-up care. Which precaution should an LPN use when caring for a patient with C. difficile? A. Standard precautions only. B. Airborne precautions. C. Contact precautions with soap and water hand washing. D. Droplet precautions with surgical mask. Answer C. C. Difficile spores resist alcohol. Hand washing with soap and water and contact precautions prevent spread. When assessing an elderly patient for dehydration, which finding is most reliable? A. Skin turgor on hand. B. Dry mouth. C. Decreased urine output and dark urine. D. Sunken eyes. Answer C. In elderly patients, turgor is unreliable. Urine output and color provide better hydration assessment. A patient suddenly becomes unresponsive with no pulse. The LPN's first action is to A. Begin chest compressions. B. Call the provider's office. C. Check the patient's medication list. D. Place an oxygen mask immediately. Answer A. According to BLS guidelines, immediate CPR with chest compressions is the first response in cardiac arrest. When inserting a urinary catheter, sterile gloves are contaminated. What should the LPN do? A. Continue with the procedure carefully. B. Use the contaminated gloves for cleansing only. C. Remove the gloves and replace them with new sterile gloves. D. Ask another nurse to hold the catheter. Answer: C. Once contaminated, sterile gloves must be replaced to maintain aseptic technique and prevent infection. A patient prescribed morphine reports itching. The LPN should interpret this as A. An early sign of anaphylaxis. B. A common side effect due to histamine release. C. A sign of overdose. D. A result of poor hydration. Answer: B. Mild itching from histamine release is a common morphine side effect, not an allergic reaction unless severe symptoms occur. Which action ensures safe administration of ophthalmic drops? A. Place the drop directly on the cornea. B. Pull the upper eyelid upward. C. Instill the drop into the conjunctival sac. D. Touch the bottle tip to the eyelid for stability. Answer: C. Drops should go into the conjunctival sac without touching the eyelid or cornea to prevent contamination. A newly admitted patient is anxious and uncooperative. The LPN's best initial response is to A. Administer a sedative immediately. B. Report to the charge nurse without interacting. C. Remain calm, use open-ended questions, and build trust. D. Ignore the behavior until the provider arrives. Answer: C. Establishing rapport and therapeutic communication helps reduce anxiety and promotes cooperation in care. Which finding indicates fluid volume overload in a patient receiving 4 fluids? A. Sunken eyes and dry tongue. B. Flat neck veins and tachycardia. C. Crackles in lungs and bounding pulse. D. Hypotension and weak pulse. Answer: C. Fluid overload leads to pulmonary congestion, distended neck veins, and bounding pulses, requiring immediate reduction in flow rate. An LPN is caring for a patient with a stage 2 pressure ulcer. Which dressing is most appropriate? A. Dry sterile gauze. B. Hydrocolloid or foam dressing. C. Transparent film only. D. Betadine-soaked gauze. Answer: B. Moisture-retentive dressings like hydrocolloids promote healing in partial thickness, stage 2, ulcers. Which observation indicates effective use of an incentive spirometer? A. Patient inhales slowly and maintains the indicator in the target zone. B. Patient exhales forcefully into the mouthpiece. C. Patient uses it before every meal only. D. Patient breathes normally through the device. Answer: A. Slow, deep inhalation improves lung expansion, preventing atelectasis post-surgery. A patient with heart failure is on fluid restriction. Which nursing action supports this order? A. Encourage unlimited ice chips. B. Document all fluid intake, including fore and oral routes. C. Restrict solid foods. D. Increase sodium intake to retain fluid balance. Answer: B. Accurate recording of all fluid intake helps maintain prescribed limits, preventing fluid overload and worsening heart failure.